I didn't have any plans or expectations around giving birth. I planned to go into the hospital pregnant and come out with a baby. Um, I, I kind of just assumed that it would all go smoothly, that everyone would be healthy and happy, and we would all be smiling at the end of it, exhausted, probably in a lot of pain, but that it would all go well.
I was expecting to have a natural birth and not have the birth that I had. I wasn't expecting to have a C-section.
Well, I had 2 children before, but there was a big gap in between. But I also work as a midwife, so I have been, around people having babies. So my expectation was that things would go well, and I knew what to expect, and I had good plan in place.
My mother had a really traumatic birth when she had me. She was in a coma afterwards, and I was really premature and only 3 pounds. So I kind of got brought up with these stories of how birth is this, life-threatening experience, really. But then as I grew older and friends had children, I heard much more positive stories of home births and water births. So I had mixed ideas of what it could be.
I just assumed that you just go in, give birth, and go home all within 24 hours. That's the experience I've had from friends and family. They've literally gone in, given birth, and within a few hours posting photos of off going home. Didn't expect the long stay I had.
So I had her in November 2010 and I was 38.
My daughter is now 3 years old, just over 3, and I was 35.
I had Finley in January 2017 and I was 31.
I had my first son when I was 32, 21 months ago.
I was 17 and I had my baby in 2013.
Because I was so tired and so exhausted after a really long labour that I don't think I was really told what was happening and why, or maybe I was, but not kind of directly enough. I went from being at 10 centimetres and pushing a baby out and thinking that everything was okay, even though it was quite far from the kind of situation I would have hoped for, to signing a consent form and having my earrings taken out. And I remember being rolled into theatre with the lights in the corridors and not quite knowing why. And I think that has had the biggest impact. It's the lack of understanding, and the fact that I felt a little bit disrespected or not really cared for because I wasn't informed. I felt totally out of control and really scared.
It was all calm panic, if that makes sense. So all the midwives and doctors were amazing and they looked after me beautifully and kept me informed of everything that was going on. I think a part of the scariness is that I was a midwife, so I understood it at a level that made me realise that I was in danger, that my life was threatened. And I think realising that, or believing that I wasn't going to make it, was the ultimate bit, because I wasn't going to see my big children again. And I actually thought I'd never meet her as well. So that moment where I thought, oh, this is it, that was really probably one of the worst moments.
I was just so terrified of what could happen, what might happen. I was absolutely convinced that one of us or both of us was going to die in that room, and there was nothing anybody could do to help us because nobody would listen. The helplessness was complete because I had an epidural, so I couldn't move, I couldn't go anywhere. And I don't think some medical staff realise how intimidating they can be. They obviously don't mean to, but the fact that you are laying down and all these people are standing over you is actually quite scary when you're already scared and in quite a unfamiliar and unpredictable environment.
Not being believed, not being listened to, and being lied to. When you know what you're saying, what you're asking is true. Like when I said, I'm really poorly, I'm in a lot of pain here, and they're like, you've just given birth. Making excuses as if I was just being some sort of weak person that couldn't deal with the afterbirth of a C-section, when I knew it was more.
I think the worst aspect for me was not being able to see my son until the next day, as I was really highly medicated, so I kept falling asleep quite a lot. I wasn't able to breastfeed him on that night because I couldn't meet him till the next day. Also, suffering from nerve damage and having retained products after birth and on and off infections for the past 5.5 years has been the hardest part for me.
I think my first symptoms of there being a problem were once she came home. I had been suffering from reoccurring nightmares, which were really debilitating because I couldn't sleep, so I would have them repeatedly in the same night. They always were the same. They were always my husband carrying a small coffin, and that used to obviously wake me up. I'd be really upset and shaking, and I'd be scared to go back to sleep because I knew it was coming again. That caused me to have a lot of exhaustion, and that in itself can make somebody feel, a little bit unhinged. I found that I was quite defensive, and I could be angry if, people weren't doing what I expected them to do. That turned into hypervigilance when she came home. The nightmares weren't as bad. I had occasional ones, but they weren't as bad. But I couldn't keep my eyes off her. So if I went to sleep at night, it was only after staring at her for hours and hours, making sure that she was okay. If I fell asleep, I would wake up kind of startled, like I hadn't meant to go to sleep. And then I'd be too scared to look at her because I'd think that she died. I knew it wasn't rational. I had the thoughts in my head, this isn't rational, these thoughts. But I couldn't stop them. And I didn't really identify that they weren't normal either. It was just how I was being. And I could compare it to my last 2 children, and I didn't do any of that. So I knew it wasn't right, but I was almost too scared to tell anyone that I was having it.
Physical symptoms I've developed after having Roman, my son, were pain. 21 months on, I still get pain. I can not really lift him for too long periods because of the pain in my belly still. But that you can kind of, with painkillers, you can get through, and you learn to adapt with your physical pain by limiting yourself to what you do during the day. Mental side, emotional side is a different story. There's not a day doesn't go by that I don't have to talk to someone about it because that's my therapy in the sense of getting it out there. I also suffer with PTSD, and it's hard because you trigger for your PTSD, you're staring at it every day. And you've got to love your trigger because your trigger's your child. And some days you don't want to, because you just want to forget, but you're a mum, you've got to carry on. You can't just ignore the trigger and think of something else because that child depends on you. And then it's hard emotionally because you explain to someone that you've got PTSD from giving birth, and their immediate reaction is, well, how can you call giving birth to a beautiful child a trauma? It's a blessing that some people don't get. And I totally understand that because naively, I probably would have thought that maybe deep down myself until you experience it. But that's the guilt of feeling like this, the guilt, because you know that people in this world don't have kids or can't have kids, and you've been blessed with a kid, but you triggered every day by thoughts and memories of what happened, and that's what I find hard to deal with.
I remember the moment that my daughter was born, that I felt really numb. I didn't really feel joy. I didn't even feel relief. I just felt totally numb. And when we took our baby home, we carried on. We had a newborn baby to deal with, and thankfully, I don't think it affected my relationship with my child because we have a really strong bond. So I think I threw myself into making sure that our kind of birth experience didn't affect her, and kind of didn't really look after myself very well. When my daughter was 6 months old, I was diagnosed with having postnatal depression by the GP, and I was referred to our local wellbeing service to be kind of properly assessed and given treatment. That took quite a while to happen, and when I did finally have an appointment, I was diagnosed with experiencing stress and not given any counselling or any kind of support. So, carried on with life. It got to a point when I was just feeling really sad and feeling quite guilty, and experiencing feelings of anger, and had kind of these quite negative ruminating thoughts, and nightmares and flashbacks, and just kind of started to really feel that this wasn't right. This is different to being stressed or being depressed. This must be something else. So I just did lots of reading and connected with the Birth Trauma Association, and kind of found some books that just helped me understand what was happening. And 6 months ago, so just before my daughter turned 3, I was diagnosed with having post-traumatic stress disorder, which was quite a revelation, and I'm having therapy to work through that.
I kept her with me lots. Luckily for me, the bonding was really good, and I breastfed her, so she was reliant on me anyway. But I felt like I couldn't leave her like I had my other children. She had to be near me. And I was aware that wasn't usual behaviour. People don't have their children in their eyesight all the time. And then, I would try and make myself leave her somewhere, but that would cause me a lot of anxiety. So anxiety and hypervigilance are not really a good mixture.
I really threw myself into, building a strong bond with her, a strong attachment with her, almost to the detriment that I maybe was hypervigilant. So she, wouldn't settle for anybody else, and that was really challenging for myself and for all of our family around us. Obviously she's getting older now, so that's getting easier, but actually, that hypervigilance probably was quite a negative thing, and had quite a big impact on us as a family.
I was always scared that something would happen, that I was always terrified that he would die. I was always worried that I would put him to bed and he would not wake up, that I would put him in the car, that we would crash, that something would happen, to the point where whenever I put him to bed or put him in the car, I told him that I loved him, because I wanted that to be the last thing he heard if anything happened.
Me and my son, we didn't have a bond straight away. I didn't hold my son till he was 8 days old. And even then, I was padded with pillows because he couldn't touch me. It was too painful. So I had pillows all around me, and he was just plonked on a pillow, and I was cuddling the pillow in effect with a baby on it. I didn't change his nappy for about 6 weeks. I didn't feed him with his bottle for a couple of weeks. So we didn't have that bonding time that a lot of mothers get, that initial few weeks. And even now, 21 months on, he knows I'm his mum. But he wouldn't run to me if needed. He happily played by himself. He's not needy with me. He's just I feel sometimes that I'm looking after somebody else's child, even that I just love this boy more than anything in the world. But I feel like I'm not his mum, and that's how it feels.
I didn't talk to anybody about my feelings for a long time. What triggered it to all come tumbling out was I had my first flashback. I was standing in the shower and I looked down and suddenly there was just blood everywhere, gushing down my legs and everything, and I started screaming. My husband came rushing in and was saying, what's wrong? And I looked down and there was nothing there. And so that really scared me that I was now, hallucinating. And he, took me in, sat me down, and it all came gushing out, everything that I'd been feeling and what had been happening. And he took me to the GP as soon as possible. The GP was really supportive. She gently told me that she thought I was having symptoms of post-traumatic stress disorder. She told me that she could get me help, that I wasn't on my own, because I felt so incredibly alone at that point, even though I was beginning to get help. And she also reassured me that I wasn't going crazy, that this was, an illness that could, I could get better from. And after that, I felt I had some courage to tell my friends. Some of them are also midwives as well. And a few of my closest friends said that they'd felt something was wrong with me, and they felt bad that they hadn't said anything. But equally, had they said anything before that point, I think I just would have been defensive and angry, because that had been my status quo all the time, was to be, defensive and angry. So it all had to happen in the way that it did. And then I started therapy after that.
I was so scared to say it because I was convinced that the way I was feeling was just how all new mothers felt, that it was hard, you're tired, your emotions and your hormones are everywhere. And I remember speaking with her about it, and she said to me that the way I was feeling was not normal. She said it was a step beyond that, and she was going to call my health visitor and send her round, because she was worried about postnatal depression. And I remember she was the first person who made me feel like it was okay to not be okay, that the way I was feeling was not how it was going to be for the rest of my life, and that there was something I could do to get better and to have a better future. And I never knew her name. I couldn't tell you who she is. But that one nurse just asking that simple question and following up on it changed everything. I have no idea where I would be if she hadn't have just asked how I was.
I haven't really shared the full story with many people. Obviously talking to close family, but I think I'm quite a private person, so it's something that has happened, and you kind of move on from. I guess talking to healthcare professionals, it's kind of a mixed experience really. My GP was just kind of, yes, you've got postnatal depression and we're here for you, and you can have some antidepressants if you'd like. So there was this, I kind of feel that there is a lack of understanding of what a traumatic birth can do and the effect that it has on all levels, I guess.
And I found it very difficult to open up to my family and my husband about how I was feeling, because they're all very practical people. They wanted to know what they could do to help. And the honest answer is, I don't know. I didn't know that there was anything they could do, because I was so convinced that I was broken. And it's not true. There is always something they can do, even if it is just giving you a hug or making you a cup of tea. there is always something that someone can do to help you.
I found the Birth Trauma Association Facebook page really, really useful. Just being able to connect with other women who've been through similar experiences and to share stories is really positive and really reaffirming. And just having that network of women to connect to is obviously just a really positive thing, but everybody on the Facebook page is just so supportive and so kind that you know that if anything comes up, you can pop a question on there and you'll be heard, you'll be respected, you'll be understood, and that's just fundamentally really important. So that's been really beneficial.
Since I've joined the BTA on Facebook, I've met a lot of women that have been in the same situations that I've been able to speak to, that we understand each other's situations, and it helped me to understand my symptoms as well.
I got put in touch with the BTA and on their Facebook group, which is good because you hear other people's stories and you know you're not alone. You know you're not wrong feeling what you're feeling, that it's quite normal, and it's a safe group that people don't judge if you're having a bad day.
I was able to read what all these women were saying and go, yeah, me too. And some of these women's stories are absolutely horrendous, and you just cry reading them. And you think, how can anybody come out the other side of that? And then they post and say, oh yeah, 6 months later, I'm fine, we're fine, and we're all, happy families. And you're just like, oh, okay. So if they can make it out the other side, then maybe I can too. And that kind of gave me courage, and it gave me confidence to stick with the therapy and to really open up and engage with it more, because I had seen that these women had done that and had come out the other side.
I went to a local organisation that offers psychological therapies, and I was assessed. And then they decided that the best treatment for me at that point was cognitive behavioural therapy. I'm aware that that's not right for everybody who has suffered birth trauma, but I was lucky that for me that was, a really good option. And part of that was reliving the process, what happened on that day, and going through things like that. So I was very vulnerable during that time, but they were very sensitive to my needs and looked after me. And I do feel that that was the turning point. And certainly after that, I felt a lot more recovered. I think that recovery carries on even after you finish therapy. But for me, the cognitive behavioural therapy gave me tools to use so that when I was feeling anxious or hypervigilance was coming back in for some reason, that I would use the tools that they taught me to control it and, become more stable again myself.
I've had some art therapy, which was really useful. But more recently, I've been seeing a private therapist, and I have started some EMDR, eye movement therapy, which has been really, really positive, and I'm starting to feel more in control and more lighter. I'm starting to feel more like myself again. So that's something that's working for me.
I haven't received counselling at the moment, but I've just been referred for EDMR counselling, so I'm hoping that can do some benefits, but I haven't received any at the moment. The treatments that I've been receiving are for my physical health, and medication was given for depression and anxiety.
The talking therapy I've had really did help, because it was an hour a week of releasing my thoughts and feelings that I have to keep inside the other 6 days of the week. And that was really, really helping. I had about 6 months of that, which was quite a long time. And then they moved on to the EMDR, which I couldn't click with. I heard a lot of good things about it on the Facebook birth trauma Facebook group. And so I thought I was quite excited to try it, but I just couldn't click with it. And they don't think I'm quite ready at the stage to do that yet. So I think I'll be having more talking therapy, more, maybe a bit of CBT before I even do another course as EMDR. So that's where I'm at the minute.
And it wasn't until I actually shared what I was really thinking and really feeling in the deepest, darkest part of myself that I actually started to get better. And it's only by letting that out, letting that guilt out, that I've actually started to improve and started to work towards finding a way forward into a place where I can actually look forward to the future and know that we will be happy and that everything will work out.
Midwives do an amazing job. My experience was that they're overworked, they're really stressed, and it's completely understandable. But there were points when, if the communication was better, was stronger, then my experience wouldn't have been as scary. If the doctors and the nurses take the time to actually probe, to dig deeper, to find out how you're feeling, and to actually trust what you're saying. Because right from the very beginning, I had said that something wasn't right. I didn't feel right. I didn't feel I could do it. And it wasn't me just being afraid of labour. It was me saying that I really don't think I can do this. And they didn't listen. They pushed me into doing it. They pushed me into an induction, and it didn't work. And I think to just listen, to not underestimate a mother's intuition.
I think listening to the patient's really important, because then you'll get a proper understanding of what they're actually trying to say. As before I was taken down for a C-section, I did want to push at the time. I think that maybe if I was checked to see if I had been further dilated, that I wouldn't have had to have a C-section.
That midwife that left me in that toilet, I'd love her to come see 21 months on what devastation has been caused because I wasn't listened to about my own body. If she had listened to me that one night for 5 minutes and acted on what I said, I wouldn't have had to gone through numerous operations. I wouldn't have had to not had a bond with my son as bad as it is. I wouldn't have been going through waiting for another operation. I wouldn't be having counselling, and I wouldn't be crying every night. So all she had to do was listen for half hour, if that, and act on it, and it could have been a different story. It really could have been. I wouldn't have nearly died twice, and I wouldn't have to think about that every day, and I wouldn't have to stop myself from wanting another kid, because right now I couldn't think of anything worse. But I know in my heart I would love another child, but because of them not listening, that choice could well be taken away from me now. And that's why I want them to see that it's not just when your shift finishes, our lives don't just stop. They carry on. And this could have all been prevented. So just listen.
I think it's important to share your story and to look for other people that have been through the same thing, because I think that's been the most healing thing for me, going through all of this, that finding someone that I can relate to and sharing my story to help others.
I think if women are suffering birth trauma, they need to understand they're not alone, that there are people out there that can help them. And I would urge anybody who's feeling any symptoms that make them feel like they're not behaving normally to go and get some help, and keep going back and getting help until somebody listens, because this is your life, your baby's life, you know, your partner, your relationship. It impacts everything, including your job. And for a lot of people, they can't carry on with their relationships, they can't carry on with their jobs. So get help as soon as possible so that you can start your road to recovery.